Stress, long hours working at a computer, a challenging workout, they all can be a pain in the neck. But if you suffer from chronic neck pain, you'll want to listen to our next guest. This is Dr. Kevin James. He's one of the first spine surgeons in our area to offer this new FDA-approved cutting-edge technology. This is exciting stuff, Dr. James. What technology are we talking about?
Well, I'm here to talk about the MOBI-C total disc replacement system. It's used for neck surgery.
Okay, so what's the difference between a fusion and a total disc replacement procedure?
Well, the goal of each surgery is the same, essentially. You want to remove a damaged disc. That damaged disc is putting pressure on the spinal cord or putting pressure on the nerve leaving the spinal cord. That tends to cause headaches, pain that radiates down the arm, neck pain. So the beginning of each surgery is really the same. You remove that damaged disc. And after removing that damaged disc, you have to put something in its place. So with the fusion procedure, what you're going to do is you're going to put a piece of bone or a plastic cage and a plate on the front. That allows the neck to fuse together. Now, the downside of that is once that fusion occurs, it puts additional stress on top of the disc above your fusion and the disc below your fusion. That's what you're seeing in the video here now with that red disc. The difference with the MOBI-C total disc replacement is that you actually replace the disc instead of fusing those vertebrae together. That maintains the motion of the neck and helps protect the rest of the neck for the rest of your life. Okay,
so you've seen lots of innovations as a doctor over the years for these procedures. Something like this probably excites you a lot. What made you interested in this technology in the first place?
Well, in 2009, I had the opportunity to go to France to meet the designer of the technology. I interviewed him about his patients. He told me about his outcomes. I got real excited about it. Also, while I was there, I had the opportunity to actually operate with him, and I put one of the MOBI-C devices into one of his patients. When I returned back to the United States, I called him to follow up on how the patient was doing. The patient had a phenomenal result. So after that day, I decided this was the technology I wanted for my patients.
Yeah, sure.
So in August of 2013, the FDA finally approved the device for usage in the United States. I went to San Francisco. I got my certificate for training to put the device in, and I was actually one of the first surgeons in the area to provide that for his patients.
Way to go. That's really great for so many people who have been suffering for a long time. This is great to also hear after the surgery how well those patients are doing. So what makes this so different than others on the market, this procedure?
Well, there are two other designs on the market that I've been trained in. One of the designs actually uses screws to fix the device to the spine. The problem with that is once you put those screws in, any subsequent surgery, you'll have problems with it because the screws are there. The other design actually uses a keel, which is a chisel that goes straight down the vertebrae, and that can damage the bone. So one of the advantages of the MOBI-C technology is that it spares the bone. The second, and actually the most important advantage, is that it's the only device FDA approved for two-level surgery in the neck. Okay. Most patients don't just have one disc herniation, they have more than one. In fact, most of them have two disc herniations, and this is the only device you can use with those patients.
Okay, so this is a two-level procedure, so it's obviously, like you said, very superior. So people that would traditionally opt for fusion, this would be a good procedure for them.
Yes, and there are several advantages to this that has been studied. They have studied two-level neck fusions versus a two-level disc replacement such as the MOBI-C.
Okay.
And what they discovered is that after 48 months or after 2 years, the fusion patients were coming back in, and half of them actually showed changes on their x-ray adjacent to their fusion. Then they looked at the MOBI-C patients, and that rate was about 33%. So we're looking at a difference of 50% versus 33% in terms of protecting the additional levels adjacent to the surgery.
That's great. Okay, so how about recovery time?
Recovery time is a lot less, and there's a dramatic difference there. What I was noticing when I would fuse patients, first of all, it would take them 3 to 4 months just to fuse together. Then after they fuse, they would need a month of rehab afterwards. So we're talking about a 4 to 6 month recovery for a fusion, and in 4 to 6 weeks, my total disc replacement patients are up and they're doing what they used to do.
That's awesome. That excites you as a surgeon, I'm sure, to see all these people recovering so well, and you're making a difference here in North Texas. So thank you, Dr. James, for being here. Here's where you can get more information. Advanced Spine and Orthopedics is located in South Lake. For more information, call 817-310-8783 or check out their website. It's asodocs.com.
All right.